Piles. Piles is another term for hemorrhoids. Hemorrhoids are swollen veins in the lower anus and rectum. This swelling can cause localized inflammation of other tissues. What are piles? Swollen veins in the lower anus and rectum cause piles. They can cause tissue growths in and around the anus, causing significant pain. The size and location of these growths can vary. Internal versus external piles. Internal piles form within the rectum and are typically not visible on an external examination. In some cases, however, an external pile may form and protrude from the anus. Prolapsed hemorrhoid is the medical term for this. Medical professionals grade internal piles on a 4-point scale. Grade I, the growth does not cause symptoms and does not protrude out of the anus. Grade II, the piles may prolapse from the anus but return inside independently. Grade III, the piles prolapse and only recede within the anus with manual intervention. Grade IV, the piles prolapse outside of the anus and a person cannot push them back in. External piles are small lumps that form on the anus's outside edge. They are extremely itchy and can be painful if a blood clot forms because the clot can obstruct blood flow. External piles that have thrombosed or clotted hemorrhoids require immediate medical attention. Symptoms. In most cases, the symptoms of piles are not serious and resolve on their own. An individual with piles may experience the following symptoms: painful lumps in and around the anus, itching and discomfort around the anus, discomfort during and after passing stools, bloody stools, excessive anal bleeding, possibly leading to anemia, infection, fecal incontinence, anal fistula, strangulated hemorrhoid, in which anal muscles cut off blood supply to the hemorrhoid, causes piles, result from increased pressure in the lower rectum. The blood vessels around the anus and the rectum will stretch under pressure and may swell or bulge, forming piles. This may be due to chronic constipation, chronic diarrhea, lifting heavy weights, straining when passing a stool. Risk factors. Certain factors may increase a person's risk of developing piles, including pregnancy. Up to 50% of people experience hemorrhoids during pregnancy. This is due to increased pressure on the pelvis, a person having a higher blood volume, and a higher incidence of constipation. Age. Piles are more common in older adults. Around half of people over the age of 50 develop piles. Weight. Research suggests that being overweight may increase a person's chance of developing piles. Diet. Eating a diet low in fiber may increase the likelihood of a person having piles. Diagnosis. A doctor can usually diagnose piles after carrying out a physical examination. They will examine the anus of the person with suspected piles. The doctor may ask the following questions. Do any close relatives have piles? Has there been any blood or mucus in the stools? Has there been any recent weight loss? Have bowel movements changed recently? What color are the stools? Treatments. In most cases, piles resolve on their own without the need for any treatment. However, some treatments can help significantly reduce the discomfort and itching that many people experience with piles. Lifestyle changes. To manage piles, a doctor will first recommend some lifestyle changes. Piles can develop as a result of bowel movement straining. Constipation is the cause of excessive straining. A dietary change can help keep stools regular and soft. Consuming more fiber, such as fruits and vegetables, or primarily eating bran-based breakfast cereals, is one way to accomplish this. A doctor may also advise a person suffering from piles to drink more water. Medications. Several medicinal options are available to make symptoms more manageable for piles. Pain relievers. Over-the-counter pain relievers such as aspirin and ibuprofen can reduce discomfort. Stool softeners. Stool softeners and laxatives can make passing stools easier, which can reduce pain from piles. Corticosteroids. Corticosteroid creams and ointment can reduce inflammation, pain, and itching. Surgical options. Bending. The doctor places an elastic band around the base of the pile, cutting off its blood supply. The hemorrhoid will typically fall off within a week. Sclerotherapy. A doctor will inject medicine into the hemorrhoid to make it shrink and eventually shrivel up. This is effective for grade 2 and 3 hemorrhoids and is an alternative to bending. Infrared coagulation. During this procedure, a surgeon will use an infrared light device to burn the hemorrhoid tissue. Hemorrhoidectomy. This type of surgery involves the total removal of hemorrhoid tissue. It is the most effective option for completely removing piles, but there is a risk of complications, including difficulties with passing stools. Hemorrhoid stapling. During this procedure, a surgeon will use staples to block blood flow to the hemorrhoid tissue. Prevention. Eating a healthful diet. Avoiding straining when passing stools. Avoiding heavy lifting. Maintaining a moderate weight. Staying active.